Today we're going to discuss osteokinematics. Well, it sounds like a very complex word. In itself, if we look at the roots of the word, osteo means bone and kinematics means movement. Specifically, we are studying the direction in which bones are moving. And we have names for those directions. For example, we have flexion and extension. Flexion when the bone moves forward or anterior, and extension when the bone moves back or posterior. Now that we know our directional terms, we can understand what anterior is, that's towards the front of the body, and what posterior is, that's towards the back of the body. We do have to take into consideration that we do have some parts of our body that have different names, not just flexion and extension. In such, we have the ankle, which goes into plantar flexion, that's pointing your toes down, and this is a flexion component, and dorsiflexion, which looks at pointing the toes up, which also has a flexion component. So dorsiflexion is toes up, plantar flexion is toes down. We also have abduction and adduction, and this has to do with lateral and medial movement away from the body. Now, abduction means we literally abduct or take something away from the midline, and adduction, much like addition, means we bring something to the midline. We add an arm or a leg to our trunk or towards the midline. For the wrist, we have terms called radial and ulnar deviation. We can say wrist abduction when we point our wrist away from the midline, and that would be radial deviation because the radial bone is lateral. We can say ulnar deviation when we're moving our wrist towards the midline, or we could say adduction. It's called ulnar deviation due to the fact that ulna is on the medial aspect of the forearm. For the trunk, our terminology varies as well, and we can say that we are going through lateral bending or side bending. And we have to use this terminology because in itself, the midline is in the middle of the trunk. So essentially, we are moving laterally, no matter which direction. It's just a matter of whether we're moving laterally to the right or laterally to the left. We're bending sideways. That's why we have another term called side bending. Then we have medial and lateral rotation. And believe it or not, we also have an additional term for this. And in our additional term for medial and lateral rotation, medial rotation is internal rotation and lateral rotation is external rotation. The first movement that we're going to discuss is extension. If we look at extension, specifically here we're looking at the glenohumeral joint, also known as the shoulder joint. So if we look at the shoulder, the humerus, the bone of the upper arm, is moving posterior and superior. Posterior aspect of the body as well as superior aspect of the body. So if we actually take an arrow and we draw, we could see the bone is moving posterior, and then the bone returns, and we can also see that it's moving superior. Of course, we don't see two movements. As a result, we can see an arc of motion being created by these two movements as the bone moves. And that will create that circular motion that we speak about when we say that a bone moves about its rotational axis. Now let's take a look at flexion. Looking at flexion, we're looking at which direction does this humerus travel as we bring our arm into flexion. In this case, we're still looking at the glenohumeral joint. So you could see that by looking at the glenohumeral joint, the humerus is moving towards the anterior aspect of the body. In addition to moving towards the anterior aspect of the body, it is also moving superiorly. Thus, by creating this movement, we have a movement in between, much like we have our y-axis and our x-axis, and so we create an arc of motion around the medial lateral axes on the sagittal plane. Now let's take a look at dorsiflexion. Looking at dorsiflexion, this is still a movement on the sagittal plane with medial lateral axes of rotation. So if you can imagine, you have kind of like a line going through the malleoli of the foot, okay? And the foot moves around that axis of rotation. Now let's take a look at those osteokinematics and see if we can in fact name them. So if we look at our foot, we can definitely see that our foot is going up. So our toes are migrating up and we term that superior. Okay, now the component here is seeing the anterior aspect. Because our toes are moving from the back to the front, the toes are also moving anteriorly. And we still have that rotational component that we talked about, meaning our foot is moving around the medial lateral axes of rotation. So again, it's the medial lateral axes of rotation, also known as x-axis. It is our sagittal plane, which we see from the side. And the foot is moving superior and anterior. Now let's take a look at plantar flexion. So if we look at plantar flexion, we are still looking at the patient from the side and we are in sagittal plane. Sagittal plane means that we have medial lateral axes, also known as our x-axis, going right through the medial and lateral malleoli. So now let's take a look at the direction in which our foot is moving. If you look right here, you can see the foot is moving inferior. Toes are going down and the foot is moving from anterior to posterior. Thus, it's moving in a posterior direction. So when we look at plantar flexion, the osteokinematics of plantar flexion are inferior and posterior. Now let's take a look at a different plane. So now we're looking at the posterior aspect of the patient. And we have a plane of movement that divides our body into front and back, or anterior and posterior. Thus, if our plane of movement divides our body into anterior and posterior, this means that movement parallel to that plane would be the movement happening. So if we're looking from a posterior perspective or an anterior perspective, we need to find a plane of motion that divides the body into anterior and posterior. And that plane of motion, that plane is frontal plane. So now looking at the frontal plane, we have motions such as abduction and adduction. We know that abduction is movement away from the midline. So if we try to see where our midline is, we have to divide our patient into half. This is our midline. And looking into our midline, now we look at our femur bone, which is our thigh bone, and we can see that our femur bone is in fact moving away or lateral, away from the midline or lateral. Additionally, we do have another direction in order to create that arc of motion. And that arc of motion is created by the superior direction. So thus, when we have abduction, we can see here that we are moving lateral and superior. Now let's take a look at adduction. Now, adduction is the opposite of abduction, so we need to add to our midline. So again, if we create this midline right here and we look at our lower extremity, specifically the femur here, we're looking at hip adduction and we're looking at our femur. It is in fact moving closer to the midline, and it's also moving from superior to inferior. So thus we're moving medial and inferior. Now let's look at lateral bending. Now lateral bending, much like abduction and adduction, happen on that frontal plane. What we didn't discuss earlier is what are our axes of rotation. Well, remember, the axes of rotation are our z-axes or anterior posterior, kind of like a fencing mechanism. This is probably the dimension that's most difficult for us to imagine. We cannot draw on this dimension unless we draw three-dimensional or we have a three-dimensional printer. So thus, we can pretend that we kind of have our axis of rotation right here. It's piercing through the patient. So the trunk is rotating around those axes of rotation. If my trunk is rotating around the axis of rotation, this is lateral bending or side bending. We don't have, we're at midline here. So because we are at midline, we have to say what is the side we are side bending to. And because we're looking at the posterior aspect of the patient, we are side bending to the right. Had we been looking at the anterior aspect of the patient on that side, the situation would be reversed. So again, if we go back to our z-axis here with the x, these would be our axes of rotation. So we need to figure out, where is my spine going here? Well, we know that it's going inferior and we know that it's going lateral, away from midline. So thus, our spine is really creating that arc around those axes. Now let's take a look at ulnar and radial deviation. Ulnar and radial deviation are also on the frontal plane and also with z-axes. So again, we have to imagine that we draw our axes going right through from the front to the back of the patient. Specifically here, we're looking at ulnar deviation. And as I indicated before, the reason it's termed ulnar deviation is because the ulna is on the medial aspect. You can term this medial deviation, or you could say that this is wrist adduction as it's moving towards the midline. Now let's take a look at the directions in which this hand is moving. So we know that this hand is moving towards the midline, that's medial, and it's also moving superior. While there's not a lot of superior movement, it's still an arc of rotation that's created around the axes. Now let's take a look at radial deviation. Looking at radial deviation is also termed wrist abduction. So we have the same situation where the axes of rotation are z-axes or anterior posterior. So thus we have to imagine that these axes of rotation go through the patient. Looking at the plane of movement, this is the frontal plane. And now we have to take a look at what are the osteokinematics of the hand. We could see that the hand is moving away from the body. That's lateral, or away from the midline is a better term. And we could see that it's moving superiorly. So thus, the osteokinematics of radial deviation, also known as wrist abduction, are lateral and superior. Now let's take a look at medial rotation. Medial rotation is also termed internal rotation. In this case, we're looking at the shoulder. So if we need to go back to our axes, well, we are looking at our patient from the front. This is not the frontal plane. So let's take a look. If you can imagine a hinge going through this bone, where would it be? Well, my axes are my y-axes, or superior, inferior. The hinge is right there at the shoulder, okay? And my plane is transverse, which cuts the body into, or separates the body is a better term, superior and inferior. So that's our medial rotation and lateral rotation will happen on the transverse plane. Now, if we look, our arm is very much rotating anterior around the axis of rotation. Now let's take a look at lateral rotation. Looking at lateral rotation, our axes of rotation are still y-axis or horizontal. Now looking at our y-axis or horizontal, we need to look at the transverse plane. The movement is parallel to the plane that separates the body into superior and inferior. Except now, unlike medial rotation, the arm is moving posterior around the axis of rotation.